Hello and welcome, everyone. We're going to give everybody a few minutes to get logged on, and we will begin momentarily. Welcome, everybody. We are going to begin shortly. Welcome, everyone. I am Adam Lush, the Regional Resource Director for Caron Treatment Centers in the Greater Philadelphia area. On behalf of Caron and our co-host, Ambler Counseling, I would like to welcome everyone to today's webinar entitled, Don't Panic, There Is No Normal, Caring for College Students in the Age of COVID-19. Today's presentation is eligible for 1.5 continuing education credits. We would like to thank our educational partner, CE Learning Systems, for assisting in providing these credits through co-sponsorship with the American Psychological Association. Please note that in order to receive your credits, you will need to complete the post-webinar evaluation. A link will be emailed to you directly after the presentation. After finishing the evaluation, you will have immediate access to your certificate of completion. As a reminder, you must be on for the duration of the presentation in order to receive the credit. We will be conducting this session in webinar format. All participants' microphones will be muted. During the presentation, please utilize the Q&A feature to ask any questions you may have. Depending on the volume of questions, if we can't get to your question before the end of the hour, we will have someone from our team follow up with you directly. Today, we are pleased to welcome two presenters. Kellie Brunton is the clinical director and co-owner of Ambler Counseling Center, an up-and-coming practice in Ambler, Pennsylvania, specializing in teens, individual, group, family, and integrative nutrition therapy. Kellie also has a master's in clinical work and an adjunct professor at Chestnut Hill College. She is widely sought after by the media for her expertise, especially as it relates to college students and the COVID crisis. Jonathan Saltzberg serves as the Executive Director of College Success and Career Services at the Caron Treatment Centers. Jonathan manages several innovative programs to help individuals examine what success and recovery means to them, strategically realign their career and recovery goals to achieve it, and ultimately enhance their quality of life. Jonathan founded Recovery EDU to provide guidance and resources for students to achieve their academic goals while in a continuum of care. We will begin by Kellie presenting her portion of the presentation, followed by Jonathan. At the end, we will answer questions that came in through the registration process, and if we have time, answer live questions submitted through the Q&A. Now, please join me in welcoming Kellie.
Hello, everyone. Thank you so much for taking time out of your busy schedules to sit through this presentation and learn about how we can support scholars during these unprecedented times. The landscape of mental health is changing right now. Many college students who were already struggling with mental health concerns are finding themselves, in a situation where they're unable to use their coping skills. They are having to see their therapist, via Zoom or telehealth. So this presentation will, discuss how things have changed and what are some ways that we as healthcare practitioners can break through some of these barriers and support college students during these times. Next slide, please. So COVID-19 has impacted the mental health of college students. We know this. Research is just now starting to emerge as to how college students are struggling with this pandemic. What is for certain is that things like anxiety and depression are on the rise. A mental health organization, Active Minds, which was actually founded by Allison Malman, who is actually a junior at University of Pennsylvania. Her oldest brother actually passed away, Brian, and this organization was founded to help college students. Anyway, they surveyed high school students and college students between April 10th and April 18th in 2020 about how COVID has impacted their mental health. So, the survey, it was 195 students, 71% of them indicated an increase in stress and anxiety due to the COVID-19 outbreak. They identified multiple stressors that contributed to the increase in stress and anxiety. Things like fear and worry about their own health, the health of their family and friends. And they also reported disruptions in sleeping patterns, a decrease in social interactions due to social distancing guidelines, and also increased concerns with their academic performance. To cope with the stress and anxiety, college students have sought support from others. They've reached out for help, and they've also adopted some healthy and unhealthy ways of coping during this pandemic. Next slide, please. Next slide, please. Okay, so I thought I'd share some of the positive outcomes that I've witnessed and our practitioners at our practice have witnessed during this pandemic. There, of course, have been a lot of negative things, a lot of concerning things going on right now, but some of the positive things that we've witnessed are that more students are reaching out for help right now. More students are looking on Psychology Today and Googling therapists near me, or how do I know I have anxiety? So it's opened the topic, it's opened that dialogue with teenagers and college students right now to be curious about their mental health. They're looking inward. They're trying to figure out, I'm isolating. Am I depressed? What does this look like? A lot of times they are looking on social media. So that's a positive thing, but it could also be a negative thing. It's amazing that so many platforms have all sorts of information about mental health right now. But as you all know, free information isn't always accurate information. So they're looking on Instagram, they're Googling things, they are curious about what's going on inside. It's been a great opportunity for all of us to take a moment and look inward and say, what is going on within me? My heart is racing. I'm anxious. I feel like isolating. So they're looking inward and they're internally scanning their emotional and physical health. Such a great thing right now. Students have the opportunity to form smaller, more intimate bonds, whether it be on campus or at home. I found that, working with college students throughout the years, some of them really have difficulty thriving at big campuses, big universities where, there are massive groups of people all hanging out. There's parties, there's, large sports teams, clubs with a couple hundred members in them. What I'm seeing is that, with these restrictions, students are, having to form more intimate bonds because they're in smaller groups, because they can't maybe hang out with people outside of their dorm building, or maybe because they can't, go to clubs, go to sports right now. They're, hanging out with a smaller group of people, but these bonds have become more intimate and more authentic, which I think is a good thing. There's been more compassion and empathy within healthy friend groups. So, these groups, these dynamics that, were already very supportive before, have become even more supportive. Friends are starting to talk to each other about their mental health. They're checking in with each other. They're being more open about going to counseling, which is reducing stigma. Always a great thing. And from what I'm seeing, there's been some more academic flexibility for students that thrive with a less structured schedule. So, this isn't speaking to all college students, but there are some that really work best when they can be more independent, when they can do projects on their own, when they can, study or attend class from their dorm room or from home. They're able to, think on their own, be more creative. So there is more flexibility there, and some students are really thriving with that kind of academic setting. Next slide, please. There are also negative outcomes right now. And this is, I'm sure, why many of you have taken this webinar. We're concerned. There are a lot of concerning issues right now. Students that are prone to isolation are doing this even more. It's intensified these issues in some students. They are safe in their bubble. They're used to being on Zoom for their classes, not having to go out as much, doing a lot of things from their room, from home, or from their dorm room on campus. So it does put them even more at risk. Tension has been exacerbated with families that, already have an unhealthy dynamic. It's increasing these unhealthy patterns of relating to one another. Difficult communication, stress, projecting their own needs onto their college students. The season of loss for all of us, being the wise practitioners that you are, that each loss brings up other losses. So students are probably not aware of this. For example, I'm working with a student right now who is really struggling with the pandemic. And most recently, she reported that she has been grieving the loss of her dog again. And her dog unexpectedly passed away last year. So that's been coming up again. I'm seeing other losses coming up, with friendships, relationships that might have ended. So, other losses are coming back up, and college students aren't necessarily prepared or aware of that. Past trauma coming back up, loss, being blindsided by this pandemic, unexpected restrictions, unexpected losses within families, all bring up trauma. And detachment, detachment from family, friends, world events, losing faith in the idea that things will be okay, losing faith in institutions, in people that should have been there for them, fighting reality, the idea that this shouldn't be this way. An increase in substance abuse, using substances to cope. We're seeing that there are students that, again, the pandemic has exacerbated substance use, but also students are looking for unhealthy ways to cope for the first time. So there are first time people, who are struggling with this. And an increase in disordered eating. The people here that specialize in disordered eating, that a lot of times the root of this is control. So we're definitely seeing an increase in disordered eating. A lot of these things tend to ebb and flow throughout life. And so a lot of these things that, maybe were in remission, these things that, might have been worked on with a clinician in the past, these things might be coming up now. Also seeing an increase in an unhealthy relationship with food, not just eating disorders, but, students really losing that connection with their body and how to nourish themselves in a healthy way. Again, isolating online school makes this really easy to do. It's easy to, order Grubhub or have food delivered, or, just go and eat a quick snack instead of walking to the cafeteria or making themselves something to eat. An increase in social media and screen time. A lot of people comparing, struggling with the way maybe some of their friends are handling this pandemic. Perhaps they're from a family that really sticks to social distancing, and maybe they have friends or in their peer group or friends on campus that really don't respect that. So a lot of these things were already concerns, already risk factors for college students. And as you can see, those things have really intensified. Next slide, please. There are barriers to accessing mental health care. And some of those barriers have increased, and some of them have remained the same. But one of the main ones that I find is the privacy and HIPAA concerns with college students. They're worried that if they go to the campus counseling center, that their parents will be notified. They're concerned that if they, go to the emergency room because they're having a panic attack, that their parents will find out. So it's always a concern. And just wanted to share something here about the laws surrounding this. There really is no clear-cut answer. There's a lot of variability in the way that colleges and universities handle HIPAA when it comes to mental health care on campus. So not many people know this, but colleges are often excluded from the federal privacy law that people encounter literally in all other aspects of their life. There's the Health Insurance Portability and Accountability Act 1996. This prevents our employer from, let's say, knowing that we might have acid reflux or something like that. Nearly all mental health and non-cosmetic medical interactions that involve transmitting patient information electronically for health insurance have to adhere to this HIPAA privacy rule. But if a college provides free on-campus therapy to students and does not file electronic health insurance claims, they don't have to respect HIPAA. So in my research, I found that some colleges still will respect that client's autonomy and their privacy, and others will notify parents. There's a lot of variability here. So I think as practitioners, we just need to be aware of that and familiarize ourselves with the policies and procedures of, where our client is attending school. There are additional barriers as well. Unpredictability in clients' schedules. Clients going from in-person classes to a hybrid schedule, or coming home, or a new schedule, changing classes, things like that. Coming home because they're in quarantine or isolating. So that unpredictability can make it difficult to schedule appointments, to remain consistent in counseling. There are also financial stressors from COVID. So many clients right now struggling financially, and especially, with private pay services. These are, really difficult times for a lot of people. Many people are, just now getting their unemployment claims, or they're still waiting on unemployment. So this can make it difficult for families to be able to invest in mental health care services. Their coping skills aren't being used. They're not able to use their coping skills right now. If going to the gym was a coping skill, or, hanging out with friends or visiting their grandma, the things that worked before might not be able to be used as a tool now, or those coping skills just aren't working anymore and they need a refresher. Many students are experiencing mental health concerns for the first time. Or these things were lingering all along and they're just now becoming aware of them. So, they're new to what counseling looks like. They don't know how to find a therapist. They don't know how insurance and private pay works. So they're just now looking into how to get resources. College counseling centers are overwhelmed. There are many students right now that are struggling, and some of them aren't equipped to handle the intensity of the issues that they're seeing, or the sheer volume of students that do need services right now. There's also COVID quarantine and isolation periods for students. This is something that I'm seeing a lot with my students that are really struggling. Many times on campus, if someone around you, your roommate or your close friend tests positive, you must then go into an isolation period while you're waiting for a test. This, again, a lot of variability on college campuses. Some colleges are sending students to an actual building on campus where they have to stay for 2 weeks, and other colleges are actually putting students up in hotels, believe it or not. During this isolation period, whether they get a positive test and they're getting treatment, or they're waiting on a test result, they still have to isolate for 2 weeks. They can't leave the hotel. They can't do anything. They can't see friends. They can't go get something to eat. Their meals are delivered to them. They're completely isolated. This puts them at risk, either for first-time mental health concerns, or it exacerbates some of the things that they're already struggling with. So from the students that I've worked with, there doesn't seem to be anyone checking in on them, just seeing how they're doing emotionally, and making sure that they're able to be emotionally regulated during that time. Next slide, please. Next slide, please. Thank you. Nutritional concerns at school. Keeping students safe and socially distanced during meal times has increased wait times at cafeterias and food spots on campus significantly. I've had some students say, what's the point of going to the cafeteria? I'm not going to be able to get in and out in under an hour and a half. It's increased wait times, which makes it more of a hassle for students to leave their room, walk to the cafeteria, or walk to the lounge or cafe and stay there. It just can impact things significantly. Some colleges are delivering meals to keep students safe. So, the students are picking what they would like ahead of time, and then their meals are being delivered to them in their room. This also has some complications with it. The options are sometimes very limited, and students who have allergies or dietary concerns are struggling with those choices. A couple students that I work with are, saying, I'm just ordering rice because that's the only thing that I can eat. So there are students that are trying to find control through food. They're becoming more rigid. They're restricting. They're starting to have an unhealthy relationship with food. Online learning can make it easy to isolate and, not go to the grocery store, not make yourself food. Financial stressors also play into this significantly. Some of the students that are struggling with their school's options for food, if their parents are able to, a lot of parents are sending their kids HelloFresh meals or sending them gift cards to buy food or have food delivered. And what about those students that, their families can't afford to do that? So next slide, please. How can we challenge some of these barriers as healthcare practitioners? I'm sure many of you are in a situation where you're evolving and adapting your practices and trying to be creative about the ways that we help our clients. I think we need to be more flexible with our availability, the times that we are technically in office or offering telehealth sessions, the times that we're able to call clients back or email them, just being available during odd hours, days, maybe a day when we normally wouldn't be seeing clients, and even holidays, offering check-in services. That's something that we've been doing at our practice, being open to checking in with a client on, a holiday or a birthday or a significant, significant day for them, whether it's the loss of a loved one or, the day that they experienced a breakup, just being more open to check-in calls with clients and talking about that in advance with our clients. And involving parents and families. Some of us are, with our longtime clients, we've never had to involve the family before. And with COVID and all of the uncertainty, we're having to involve parents as another layer of support and sort of acting as a mediator between these college students and their families. A different approach when new clients reach out, just being open to staying on the phone longer. We're all so busy, and we're trying to do the best that we can right now. We've got a lot of calls recently from clients that can't seem to get a call back places. They're on a waiting list. They've left voicemails. A lot of places are full. They're not accepting new clients. So just being aware of that, and sitting on the phone with somebody and just hearing them out. We've had so many people, even if we can't help them, or we don't accept insurance or whatever the case may be, people are just so thankful to just be heard and talk to someone on the other end of the phone. So, and familiarizing ourselves with resources. I know we all do that, anyway, but really thinking outside the box and being creative. I've had to reflect on the list that I have of resources, and really like make some calls and do some investigating and find out more. So this time it's a really good opportunity to do that, and recognizing the importance of self-care, especially right now, just looking inward and recognizing what our limitations are, what our boundaries are, and just really making sure that we're in a good space to be able to provide quality care. Next slide, please. So I just wanted to share some of the things that we've been doing at Ambler Counseling Center. And I'm sure there are a lot of places doing this right now as well. But I just wanted to share it. And if any of you have any cool ideas, or I just think we should all share with each other right now, and offer some cool creative things, just to support everyone right now. So we're offering more flexibility with scheduling appointments. So we aren't open, like a typical like Monday through Friday, 9 to 4 or something like that. We do allow our clinicians to make their own schedules, but our therapeutic approach at the practice really is to be very flexible. So clinicians work on holidays, nights, weekends, odd hours. We have a lot of people, they're in nursing school, they're working night shift, they're bartending, they are working 2 jobs, they're only available weekends. So just being more flexible during these times, I think that's something that we should all, reflect on. Checking calls and emails for clients, because of all the stressors and barriers that I just talked about. Clients might not be able to come in every week. They might not be able to afford to come in, or they might have other things going on that they need to work on. So, assessing that client and really making sure that they are, not at risk, and being okay with a check-in call. Or for, some of our nutritional clients, we have our nutritional health coach sending them emails every week to hold them accountable. So just being open to creative ways to support the clients. Sliding scale options. When I was calling and trying to find more resources for people, I talked to quite a few people that had a sliding scale, but then on the same token, I also talked to a lot of people that had one set fee, and this is for private pay people, one set fee, and didn't really have a lot of flexibility surrounding that. So I think just, being more open to options for people is a good thing right now. And partnering with schools and treatment centers. I mean, that's, the whole reason this webinar came to be was because we've had this amazing relationship with Caron Treatment Center. And I'll talk a little bit more, and I think Jonathan will talk a little bit more about that later, but really familiarizing yourself with the culture surrounding your neighborhood and the resources that are available. Reaching out to schools. We just did a parent information session for a local school in our area. So reaching out to schools and seeing what they need right now, and if you can offer a workshop or a seminar. I know many of you are already doing this. Providing sound machines to all clients who have privacy concerns. This is something we're doing at our practice. Just smoothing that transition over to telehealth, providing a sound machine for the client. I feel like that's just good practice, and especially with people's financial concerns right now. So we were in person, but when we made that transition, we sent every client a sound machine. Extra health and safety precautions. This is something that we've been doing from the get-go when we were in person. I'm sure many of you are doing this as well. Doing temperature checks with all clinicians that are going into the office, health screenings for all clinicians, as well as for the clients, answering questions before they come into the office. Lots of cleaning products, having remote offices. I realize that not everyone can do this, but just being creative in the layout of our office. So we actually rent space at a big office building, and having remote locations where clients don't have to walk in anywhere, don't have to go to a waiting room, just really walking right into that office. So just having some flexibility. Again, I know this doesn't apply to everyone, but having some flexibility in the office layout for clients helps as well. Next slide, please. So another thing that we've done just in response to COVID is create a college wraparound program. And we're really excited about this. We've designed a program with personalized services for college students that are impacted by COVID-19. So, we tend to think of wraparound for children and families in the community, but really recognizing that college students just need additional support during this time. So we're supporting them on and off campus, either in person or virtually. So, one of the defining features of the college experience is leaving the nest, shedding your adolescent identity and, going off on your own into emerging adulthood. But many students are having trouble finding their wings, especially with COVID. COVID has intensified some of these conflicts. If you've worked with college students before, that transition from home to campus life can be difficult for many of them. Not having mom and dad or, their guardian monitoring them with homework, not having as many boundaries, experimenting, risk taking. And with COVID, these things, these transitions have been even bumpier for many students. Today's young adults are used to their parents managing many aspects of their lives. Even in counseling, with college students, many parents want to make the appointments for their child. They want to sit in on their child's counseling sessions. But it's important for counselors to not only include the family when it is appropriate and with the permission of the student, but also to set boundaries with parents and let them know that it's time for these young adults to start having autonomy and making decisions on their own. The consequences for students who struggle to make decisions and manage their lives, are devastating. And it can impact graduation rates significantly. So it's more important than ever to support these scholars as they navigate an uncertain future. So we've designed a program. There's a variety of services that we offer. We have check-in services for students that are in isolation, whether they've tested positive for COVID-19 or they're waiting on a test, whether they're, at a building on campus or they're in a hotel room or they've been told to just self-quarantine and stay in their dorm room. We are checking in with them emotionally, whether it's once a week or a couple times a week, depending on the needs of that student, and communicating with that university and letting them know, listen, everything's okay, or hey, they're struggling a little bit. Just, keeping tabs on them and letting them know that we're supporting them. We also have on-site visits available. So sometimes, and this is something that I've done in my practice even before COVID, really assessing and identifying, whether that student is at risk. We aren't a crisis center, and practitioners need to be very careful here. There's a very fine line. So just, letting the student know, letting the college know, letting families know that, if that student is in crisis, that, we are not the appropriate level of support for them. But for students that are struggling and they don't want to go home. Maybe their parents and families are worried about them and they want someone to check in on them. Those are situations where, the therapist can actually go on site and make a visit and have a session with them. The nutritional health coach can go and, help them buy groceries or walk with them to the cafeteria and explore, the options that are there and focus on their relationship with food. This is also a situation where, we can advocate for students during academic probation meetings or disciplinary meetings. We can be sort of a liaison between the parent, the student, or the university. So it really gives us an opportunity to provide that psychoeducation, whether it be to families or educators on campus, and really advocate for that student and help them make, health decisions that are the best for them. And many of if a student is struggling, one of the worst things that can happen is for them to not be able to participate in activities, not be able to have them participate in sports or something like that. And it really could exacerbate those feelings of anxiety and depression. So again, really assessing these students and evaluating them to make sure that they aren't at risk and that they are safe. And also being really upfront about some of the HIPAA concerns with a therapist visiting them on campus and having the proper forms in place and documentation. So that's something that we're doing at Ambler Counseling Center. We have a lot of people reaching out right now for additional layers of support for college students. And, just want to encourage everyone to be creative about the ways that they can help right now. Next slide, please. I just wanted to include some additional resources for all of you. I know we're all trying to figure out tools in the toolbox for our clients. So there's a Life Hacks resilience-based program. This is actually created at Cornell, and it's an online training for college students. And it kind of talks about the realities of living during the COVID pandemic. It's for undergraduate students. They also have a graduate and professional version as well. I believe the undergraduate takes about an hour. The graduate one takes about 45 minutes. And it's really a program to help college students, give them those skills and those resiliency tools and techniques for, being a student during a pandemic. Some other resources, there's a company called Sharpen, and they are a mental health content and technology company. So they have some apps that are free to all college students. They work with mental health providers and students to provide a lot of self-help information, psychoeducation, techniques, and guidance, all about, staying safe during the pandemic. So that's another great resource. I'm sure a lot of you have heard of this one, 10% Happier. It's an app that has a lot of guided meditations. They actually have a coronavirus sanity guide specifically on there. They have a lot of podcasts and blog posts about this as well. So just, again, building resiliency during uncertain times. And then there's also one called Hope Lab. Hope Lab and Grit Digital Health released an app. It's called Nod, and it's an app that they're very evidence-based, and it's designed to help students improve resilience during this time. It talks about like social connections, tools and tips, how to stay connected to the people we care about while, practicing social distancing. So, and then the next slide, if you want to just go to the next one there. Those are the additional resources that I just talked about. So I'll give everyone a minute to write that down. And then if we could just go to the next slide. Just wanted to share some academic sources that I used for this presentation. And next slide, please. And this is our contact information. So I know I personally felt like before this presentation, I could have talked for an hour on each one of these barriers or each one of these positive or negative outcomes that we're seeing. So, this is kind of just, a brief overview of what's going on. what we're doing, what we're seeing on our end. And, this is our contact information. I'm more than happy to talk on the phone or email anyone that has any questions or just has some cool resources and wants to collaborate and talk about how we can support people. So I just want to thank Caron Treatment Center. I'm just so thankful for our Therapeutic Alliance. And just being open to working with us, and we've actually toured their facility before COVID and everything. Just we're really thankful for the collaboration and the continuity of care that we're able to provide for our clients. So thank you so much for the time.
Thank you so much, Kelly. And those are, wonderful. It was such a wonderful overview and so many great resources. We've got quite a few questions coming through on the Q&A, and I appreciate everybody that's asking these questions. We're going to do our best to answer as many as we can at the end of the presentation. If for some reason we can't get to a question, we will be sure to reach out to you individually. One question that did come through that I can answer now is that yes, you will all be receiving a copy of this PowerPoint via email, and there will also be a recording of this webinar available. So, if you didn't get a chance to write something down on the slide, you can go back and you'll have access to that information. So up next, we have Jonathan Saltzberg, who is the Executive Director of College Success and Career Services at Caron Treatment Centers, and he also runs the Semester of Support program available at Caron Renaissance. So please help me welcome Jonathan.
Unmuted, there we go. Thank you so much, Adam, and Kelly. Thank you so much for the collaboration over the past few months and really preparing for this presentation and just sharing ideas, and just all of us, it feels nice not to be alone in this. We're all working together, and how can we all support the mission, which is really helping our students. My name is Jonathan Saltzberg, and I am just grateful to be here today along with Kelly to discuss how are we working in this crazy pandemic to support our students and really help individuals access care and also be able to access their education while accessing care. And what I'm going to talk about today is kind of these objectives, but I'm going to be kind of concise. I think Kelly has really addressed so many different points. From my perspective, though, will be more of a behavioral health care treatment center perspective. I've been working with Caron Treatment Centers for the past 10 years. July 2010, we launched the College Success program at Caron Renaissance. And the idea behind that was, how can we support patients while they're in treatment address their academic goals, to address their educational goals so they can get excited about their future and not leave the milieu before the miracle happens. It's a saying we have. So to talk about that in light of the pandemic that we're all facing, in light of what's happening and how we're seeing it, I'm going to touch on today these 5 objectives, and we're going to keep it simple. Discuss the changing landscape of mental health as it pertains to college and universities. Where do you go? What do you do when you go to a college campus now, right? You're a patient, you're a student that's suffering from mental health, or first time suffering from mental health disorders or from substance use. So where do you go? What do you do? What's the landscape look like? And that directly correlates with the second bullet point, which is what resources are there for college students that we're seeing for individuals suffering from substance use disorder and mental health disorders. The other piece is really, what are the barriers that we're seeing for students that are our patients are accessing care? Isolation, depression, anxiety. These are all words that are too often too common right now amongst our emerging adults and our college students. How do we get these individuals the help they need? The other piece that I'm very excited to talk about is, what are we seeing for our population of college students at Caron Renaissance in this semester of support sober dorm program? What are we seeing that's happening with these 7 students that we currently have that are going to college, engaging in clinical services, and dealing with the pressures and struggles of and existential issues of what's happening today? And what have we learned as our clinicians have learned, and what have we learned from a programmatic standpoint? And last but not least, how are we working together? We talk about a therapeutic alliance, building a therapeutic alliance between a clinical provider and their patient, and the importance of building that rapport. How are we also building that rapport with the families? How are we also building that rapport with our private practice clinicians such as Kelly and other providers, so that all stakeholders are involved? We're going to talk a little bit about that today, and I promise not to go to be concise. Well, if we can go to the next slide, please. Who am I? Such a deep question. Who am I? I describe my role as an educational advocate. I describe my role as, you have high schools, right? High schools have a college advisor. You go to high school, you're 17 years old, you get to meet with a college advisor. They help you identify best fit college programs, whether a big school would be good for you, a smaller school, help you identify your majors, help you identify your strategy around college applications, and really, in the end, helping you find, hopefully, and your family find the best fit school, right? So my question 10 years ago was, why shouldn't treatment centers have that? Why shouldn't it be part of the best practices that a treatment center have a separate department where our job and our role is to help the individual, the young adult, the teen, the high school, the college student, really identify what their academic goals are while in treatment. Identify what colleges might be better for them than not, right? What colleges would a smaller college be better for someone who suffered from X, Y, and Z, and who could benefit from more of a cohort model? At the same time, which was so interesting, we saw this huge rise in collegiate recovery communities. Schools that offered on-campus recovery support services to sober dorms, collegiate housing, to peer-based models, to activities and all this exciting stuff, to now we see that there's over 120 universities out there that have collegiate recovery efforts. And I'll talk about where to go and check those things out. So all that I'm talking about is, how can you be that cool college advisor within a treatment framework? And now we have a staff of multiple staff members that help our patients, both in Caron, Pennsylvania and Caron Renaissance, identify and support them with educational planning while in treatment. And this all falls in line with a concept that I like to say: how can we recovery-informed academic advising? How can we get individuals to think how they can support the recovery while going back to school, and thinking in that lens? We see what the National Drug Control Strategy says, that we must how can we create a continuum of care that we see substance use disorder as a lifelong, it's the American Medical Association recognizes a disease. It takes a lifelong, addresses addiction as a chronic condition requiring continuing services and support structures over an extended period of time. Therefore, it takes a long-term model to really address this. So how are we as providers providing that and supporting our students from a Recovery for Life mission? We're going to get into that today. So I'm excited about that. Please, next slide. So the changing landscape, right? Wow. I just want to take a second just to read this slide. And the president of Texas A&M, who helped draft the plan to unify East and West Germany for the State Department 3 decades ago, he said that it was easier. That was easier to figure out how to bring back 65,000 students and thousands of staff this fall to the campus and to their campus. So I made a presentation similar to this back in July, I believe, before we all returned, or our students were returning back to the college campus. And presented with a great deal of anxiety and a great deal of angst as we approach the semester, with having seen this great number of displaced students that we saw in March 2020. All of a sudden, in the midst of this pandemic, we had all these college students that had to go home or weren't able to stay at the college. And then on the other side of, how do we get them back? And how do we get them back to the college? So when we say that there is no new normal, there is no new normal. I mean, this sums it up. And we saw, and we're seeing what's happened this fall semester on the college campuses, and we'll get back to that in a second. Next slide, please. We are in the middle of a mental health crisis. We really, really are. I mean, look at the last slide. In people aged 25 and younger, roughly 9 in 10 screened had moderate to severe depression, and 8 in 10 of those had a level of anxiety. We're seeing this. 40 out of 50 states, we're seeing higher rates of overdose, higher hospitalizations for overdose. I mean, we are in the midst, and we don't even know the effects yet of this pandemic on mental health and substance use disorder. Please, next slide. The Wall Street Journal came out with an article in July, and the article was discussing about, what universities were doing in the midst of this pandemic, as far as what universities were planning to be all in person and what universities were going to be hybrid, and what were going to be online only. And what you can see and what we can see now, right, is that you had a number of universities that were saying, we're going to be in person, right? We're 70%, 63% said we're going to be in person. That number dropped very quickly to 53% and kept on dropping, as we can see through this graph that we'll be seeing. So this level of uncertainty that our university administrators and our university faculty and staff had to deal with, right? Think about what the students and families have had to deal with that uncertainty too, right? So uncertainty, distress tolerance, how do you get those coping mechanisms together in this time that we're all struggling, quite frankly? Next slide, please. We have a saying here at Caron Renaissance that the patient's the family and the family's the patient, meaning that, what are these families going through? As we ask the patients and the students to do the work they need on themselves clinically, to address what is holding them back from realizing their potential, we also ask the families to look at themselves and to do the work they need. And these families, as they're saying their kids, or we've seen send their kids back to this college, are having such difficult questions. And they're going to have these same difficult questions to ask themselves this January. Will my son or daughter be safe on a college campus? Kellie talked about something that was very, very, very important. She said that when you're in quarantine, you get food delivered to you, or you're in 2 weeks of quarantine. Lack of social connection, right? Parents can't visit you, right? That's a huge piece, right? In this spring semester, we're going to see that. What happens if they get sick, which I just talked about? There was a safety pledge. All universities, or most universities, have safety pledges that the son or daughter would have taken this past fall semester are going to take in the spring, which says, you cannot, these are the things you cannot do leaving campus. These are, obviously rightfully so, to protect everyone around you, but trying to create this college bubble. And what happens when you do violate these policies? We saw that at universities, 250 suspensions from X, Y, and Z because all these students went off campus. And a common thing I'm hearing is, I want a traditional college experience. Am I going to have it? And I'm struggling with this isolation. What do I do? These are parents and students in this dilemma that we're all facing this past fall, and I'm still seeing this next spring. So next slide, please. So with all this level of uncertainty and all this level of trying to create an environment, college itself, if you think about college, like Kellie was saying, going away from the nest and developing the emotional maturity and being on our own and learning about ourselves and individuating, all these great human growth development pieces, right? When I'm working with students and helping them identify colleges that would be consistent with their academic needs as well as their recovery needs, right? One of the things that we ask when we want to look at is, what are the on-campus support services and the peer-based models on a college campus? For those of you who don't know, years ago, they came out with this incredible data on living learning communities, LLCs, learning communities and living learning communities. I was actually part of an LLC, which I loved still to this day, which the idea was to create a cohort of like-minded individuals that were either in the same major. Most likely, we always typically see the same major. So if you're pre-med, pre-business, you're going to a big college, you have all your classes together, you have study hall together, or you have an advisors together, you live together. So you create this kind of a commonality so that you're going through this mutual experience, this shared experience in a very big school, and you're able to build that peer-based support, right? How has that changed now that you don't have all those kind of environments? You don't have that ability to necessarily to study, to hang out. I mean, you do and you don't, right? It's a different type of experience. So as academic supports now, and as individuals, we have to look at, how are we redefining what on-campus support services? And under that same spirit, we saw this incredible concept of collegiate recovery communities, where individuals that are in recovery, where colleges have designated space, designated staff, designated housing for students that are in recovery that want that peer-based support and are going through that common struggle together, right? So looking at and trying to advise students now has changed, right? What also has changed is that telemedicine, right? Counseling services that are more virtual, right? So we have our students that are going to university, they need to be aware of, rather than having that, someone may be in treatment is able to meet with us and able to be with us, because our doors have been open at both Caron Renaissance and Caron, Pennsylvania. they're going to be transitioning to a college campus or to a virtual college campus. And really, we need to prepare them for a different experience, right? Not having that same kind of level of accountability, but in a different way, right? And to that note, the academic advisors' roles are changing, right? If you look at an academic advisor on a college campus, helping the student to develop their educational plan, do their degree audit, make sure they're on track, and really help them flush out what their goals are. We always believed at Caron Renaissance and Caron, Pennsylvania, like to build a therapeutic alliance and really to work with our university partners. We didn't mandate, but we encouraged that our patients, while they're in treatment, at some point, when clinically appropriate, sign a release, a HIPAA and a FERPA release for their academic advisor. And the reason why we encouraged that, we didn't mandate that, was because we wanted that academic advisor is supposed to be the person on the college campus that you're having the most interaction with. They're helping you really break down your classes, identifying the right schools, and also are building that rapport with you, hopefully, right? And we're seeing, we always have encouraged academic advisors to be, encourage them to be part of the conversation about the transition back to college. The good news is that now in this pandemic, academic advisors are being faced with a lot of challenging discussions around how can we support the mental health of these students, because we're all faced with mental health issues. So the academic advisors' roles are really changing, that I'm seeing, from just purely academic advising to really more, not just, I want to call it wellness advising, overall quality of life advising. Like, how are you doing just outside your academics? Which I think academic advisors have always done, but I'm just seeing a much more greater, robust conversation there. The other piece that I've noticed with this on-campus support and looking to with the transition for our patients that are in treatment going back to the college, right? Whether it's the college is virtual or not, right? Is the need for private practice providers, individuals in case management services like Kellie and other providers. And the reason being is that your patients are stepping down from a higher level of care into our programming here at Caron Renaissance. And the great part is it is a step down approach. But, we are dealing with this whole new pandemic that presents loss, isolation, things that are uncertainty that, quite frankly, we couldn't have predicted this 2 years ago, right? So you're taking someone who's in early recovery, who has made the decision and choice to put down the substance, right? But now dealing with the underlying issues behind that. So they're going to need more support. And we're finding that, the counseling centers at universities are very overloaded. So how can we get that more in person under COVID, following CDC guidelines, or WebEx or other platforms to still access and support? Next slide, please. So we talk about barriers to accessing care, and what I mean by that, and I'm going to keep in my mind on the clock because I want to make sure I'm conscious of everyone's time, is that I talked about something very interesting. When I'm working with students over the past 10 years, we've worked with probably over approximately 1,500 college students, and our role and our mission has been helping these individuals go back to school and succeed and realize their potential. And one of the things that's really important is accountability and structure, right? Accountability and structure, right? And college, although historically has had less structure, you still have your physical class you're going to be at. You still have, maybe X, Y, and Z that you need to be at. So you still have these sessions, right? However, with an online virtual platform, those, it can be asynchronous or synchronous, meaning that the classes can happen while your synchronous happening, where everyone goes and logs in at 11 a.m. to 12 p.m., or it can be asynchronous, where the classes are at a different time or are taped, pre-taped, or not everyone's joining at the same time. You don't really have that same collegial experience that you might have had if you were in class, So the timing, the structure is less. And what that happens, actually, what I've noticed with individuals not getting the care they need, is, believe it or not, I saw when people were going to class, there was a peer intervention model. What I mean by that is other peers calling each other out, noticing they weren't going to class, letting parents know of their friends' parents, hey, I haven't seen Joey or Joni at class for the past 2 weeks, I'm worried. You saw that, or professors actually seeing and developing relationships with their students and noticing someone's been out for 2 weeks. Now, granted, you can sign on for a class and I could turn off my camera right now and just listen. You don't know if I'm listening or I'm staying engaged. I mean, it's harder for professors to know how their students are truly engaging in the class. And although the assessment, the test and the exam are great measurements, or not great, or measurements of how someone's doing, we really believe that attendance and engagement in the classroom clinically can really show us how someone is progressing and how someone is on that daily, on a spot check basis, right? So we don't have that daily class, that showing up, and that less structure that we're currently seeing, I think, has led less people to getting help or getting that intervention. Again, families may not be aware of issues, right? Someone is virtually in school. Someone is, my niece was at Syracuse University and they came home 2 weeks early. Grades delayed, extensions, professors are being much more accommodating, which is great. The professors are saying, hey, you can hand in that assignment late, I know, but at the same time, that assignment late, why are they handing it late? What else is going on clinically with them? And giving them those extensions are those that could be good. Historically, that might have led to a poor grade that mom and dad would have found out about, or something might have happened that might have led to a greater conversation around Joey is actually isolating and hasn't been studying and is actually out there, in a really bad place and we need help. So I'm saying actually the virtual experience, or the hybrid / virtual experience, is actually in some cases delaying the access to care. What I've also seen is families and patients concerned over COVID-19 safety procedures. I'm pleased to report that we have been incredible at Caron. Our doors have been open since day one. We are under the strictest protocol. All of us go through a thorough screening process. All the patients are tested upon admission. So we have a really incredible safety procedure here. But again, families expressing their concern and saying, hey, can we wait till this pandemic passes? Can we wait? Which I compare to the calls I would have when I first came on at Caron in 2010 was, hey, my son or daughter is in the middle of a crisis. They're struggling with so-and-so disorder, or they're using this substance. I would like to wait 2 more months before they come to get treatment because they're almost done their semester, right? So I really do. I know that COVID's a huge concern, but listen, someone needs help. They need help now, right? If they need that help, let us assess, let the professionals like Kellie and us help you assess that. So next slide, please. So in July, I had this opportunity. I was working with this incredible student. I'll use the student's name as Holly. Holly's my sister's name, so I'll make up the name Holly. So I was working with Holly, and one of the things that she said to me was, I'm here doing classes, some are online. I have no social community right now, and I'm about to go to University of Texas, and all my classes just went to online. And I'm going to have no social community there. What am I supposed to do? That was a question she said. She was at the same time on the other side. She's so excited to get out of mom and dad's house. I'm so excited. I want to go back to school, but like, I'm not going to have only one of my classes are going to be in person. I mean, I don't know. I take COVID seriously. What do I do? Right. And, how do you create structure? How do you create connection? When times is all virtual and you're going to be back on a college campus. So how do you do it in a safe and effective way? And, the other question, the other side of it is the Lynn University student example, that this student from Lynn University was in such isolation for the past 4, 5, 6 months, right? That I got a phone call from the student's mother saying, so-and-so was supposed to take classes in January, and those classes, I know they're not taking those classes because the tuition that I'm owe, all of a sudden I don't owe that tuition. So I don't know what's going on. I'm nervous that Jackie or Joey is not showing up. There's something not right. And I don't know how they're doing, but I know that tuition is due and it's not due. So what's going on? Would you mind checking in? So I checked in on the student. He's been in isolation for the past since April, right? Isolating at his or her house, and has fallen into a deep depression and is engaging, and had to return to use. So we're just seeing these things happen where there's a delay, right? That what I want to try to say is I want to get these students talking about it earlier, right? The UT student talking about it earlier. Thankfully, a student was willing to get help and get care, and we were able to work with the university, and the student is getting the care they need, right? And the school is awesome working with us. The student's allowed to return, all that great stuff. But again, transparency, honesty, communication, encouraging our families to reach out. And I want to encourage, if you're a university partner on this call, I know, or on the Zoom, is I know that there's FERPA, there's HIPAA, there's a lot of laws, but I'm encouraging you all to communicate and try to be there for the student and try to figure out ways to educate the families like you always do on letting them know to the best of your ability under proper law how the student's doing and trying to develop that alliance with the family. Next slide, please. So in March, this huge displacement of students, right? All these college students coming home, you know, unfortunately, some people didn't have a home to go to, right? So you had all these individuals in this incredible loss. All of a sudden, you know, and we got together and we thought like, you know, we are Caron Renaissance. We provide exceptional, extraordinary care, and we historically have provided incredible care for individuals that have been suffering from substance use disorder. And on that same note, in March and April, or I think it was even earlier, that we got the ACA license, which allows us to treat primary mental health, right? So you don't have to come to us with substance use, anxiety, depression, all words that we've often know too well right now. And we thought about, like, how do we take what we're doing with our Sober Dorm program, which is a program where we have a designated building and space for individuals that are going to school, that are receiving a level of care, which can be, you know, 9 clinical hours, 3 clinical, I mean, just varies of what clinical hours can be, and are really able to create a cohort model for that first semester back to college after treatment. Can we expand this and offer this to colleges, to universities, say, hey, before the students just leave and go back home, and, you know, maybe they can come here, they can continue their classes, and if they violated their safety pledge, when they return, maybe look at us, maybe there's something bigger going on, right? You're asking 18, 19-year-olds to return this fall, August 2020, after all this pent-up demand of 6 months of being at home or not being at home, or feeling lost or uncertain. And by the way, you're going to be on a college campus, you're going to be stuck on this college campus, right? I think that it was a pretty challenging past fall, if you ask me. How can we provide structure and accountability during this time? So we expanded our Sober Dorm program to be called the Caron Semester Support Program, where we had a cohort of individuals that lived in one building. They would do online virtual school and be able to have recreational activities, be able to have clinical support, and be able to really be engaged on a daily basis with structure, accountability, and ask some existential questions of what's going on in this external environment and how can I be of service, right? So, and we wanted to look at what the gap year model looked like and what other models look like to create some spark and passion. Maybe there's an opportunity now with this pause in life to look at what I truly want to do, what I truly want to pursue, right? And have that as part of your college experience. So we worked on that, and I'm proud to say that we have actual 7 students right now in this semester support Sober Dorm program that are in college receiving clinical care, or technical school, or high school. We have 2 students that are doing high school, and really trying to provide that replication and structure and accountability. And I'm really grateful to see that. And actually, we just included equine assisted therapy in this, and we just really getting them off campus and having them participate in that. It's been remarkable. So the next slide, please. So lessons learned. What have I learned from this, from the new normal? So I believe is a my mentor would say to me, a mentor of mine would say to me, I'm sorry, I'm looking at my notes, but a mentor would say, one of my mentors would say to me, you know, it's not good for people to project out to the future, right? It's not good for us to project out to the future. We're in treatment and we're trying to look to the future. I want to think where I'm going to be 2 years from now, where I'm going to be 3 years from now. You know, we need to be mindful and think about where we are now, right? But there's a difference between projection and a difference between, in my opinion, and setting goals, right? I think goal setting and getting excited about the future is part of our role, part of my role, and part of my team's role is to get our students excited about the future. You know, have you thought about X, Y, and Z? That this is going to end. This pandemic is going to end, and there is going to, and maybe we don't know what that's going to look like, but it is, right? And you know what? There's a lot of exciting things to look at, right? And part of getting them excited, the student and the individual, whether it's about their career, whether it's about their major, whether it's about applying to Columbia School of General Studies, whether it's applying to different schools that they may not have thought of, right? It creates a motivation to change now, right? So I want to say I just want to say there's something very special about that, is to get them excited about the future with the level of motivation to change now. So that's part of our role and part of our environment. The other piece that I've learned is a very big difference in asynchronous versus synchronous, which is one, you're doing classes together, and one, you're doing classes, one that you could be just signing on anytime the class is happening and pre-recorded. I've learned that synchronous classes are much more effective for us with developing a structured class time. So 11 to 12, the teacher is going to be there. You can have a live chat. You can talk with your other students. I very much like synchronous. I think it creates a very simulated environment for professionals that are, who are going to work or working during the day, who may not be able to have that. I think asynchronous can work, but I really like that ability to be able to have live access to the class. Other piece is what I've noticed is that, and I want to share this with everyone, is that, mental health concerns need to be prioritized and expectations need to be set up front with parents. And what I mean by that is, I worked in college admissions at University of Pennsylvania, MBA admissions. I've worked in admissions at Florida Atlantic University and State University system. I love education. And I want to give hope about education, the fact that your kids are getting care and support, and your children, adult children too. And I want to make sure that we're able to attain they're able to attain their educational goals. But sometimes we have to take a stop and we have to pause the education, right? To focus on what's truly happening mental health wise. And I think that, one of the things that we've learned is that where we see someone who's in the semester of support program, that the family or the patient is prioritizing education amongst their own health, right? And we need to really address that and set expectations on the front end of, hey, this is an educational program, but at the same time, your mental health is the most important. And we need to look at why you're doing so-and-so. So next slide, please. Now, we need to work together. And this brings us back, and we're ending this fairly soon, is that 21 million Americans had a substance disorder in 2016. Only 10% received treatment. 1 out of 5 young adults in college meet the criteria for substance disorder. 8.9 million young adults who reported having a mental health illness in 2018. More than 2 in 5 went untreated. Nearly 9 in 10 did not get treatment. That's why, if we can go to the next slide, that's why I want to bring up the idea of how can we all work together? Why we are here today, Kelly, myself, and Adam, how our agencies are connected, and the importance of this therapeutic alliance beyond just the rapport between the patient and the therapist, but all the stakeholders that are involved in really building this. So I think this brings us back, Kelly, into this. And I mean, this slide is probably the most important slide to me, is how can we all work together and collaborate for a really, truly continuum of care, which fits the mission for Caron, right? Because we're Recovery for Life. So, Adam?
Thanks, Jonathan. That's wonderful. Before we move on to discussing the Therapeutic Alliance, a question did come in specific to Semester of Support. The question was, what campuses offer Semester of Support? So I just wanted to clarify for the person that asked that Semester of Support is a Caron program that can be accessed by any college student in the country. And then Jonathan will work with whatever university they're enrolled in to continue their courses virtually. Was there anything else you wanted to add to that, Jonathan?
I think I just, I mean, one of the positives is that universities are more fluid and flexible than ever. I mean, University of Pennsylvania, online classes, being able to take hybrid remote classes, online virtual correspondence. I mean, these are things we're unheard of. So colleges are willing to work with us, or in a lot of cases, allow the patient to get the help they need and still stay engaged in their original course. So we have an incredible opportunity so they don't lose track of their education.
Yes, and I want to reiterate, this is available to any student, because I saw another question come through: law students, medical students, any graduate students, first year undeclared major students can access this program. So if you have questions about that, you can reach out to Jonathan or I, and we'd be happy to walk you through more of the resources there. Looking like we have about 15 minutes left, so I want to move to a quick discussion of the Therapeutic Alliance, followed by some of the questions. So I'll let Kelly and Jonathan talk a little bit about how we've created a Therapeutic Alliance between Ambler Counseling and Caron Treatment Centers, and how that works together to benefit our patients.
Kelly, would you like to? Well, I'll go first in the sense of, again, part of our role with discharge planning and when someone's leaving here is what does their aftercare support services look like? And it's such an important question. And on my end, I usually have kind of addressed three different kind of client populations. Is the educational piece, going back to college, mostly. There's some high school cases, but that's mostly in Pennsylvania. Career-wise, looking about transitioning back to their original career or looking at developing their own career, their new career path. All three requires some level of change, right? They're going back to college sober, that's change, or in a new mindset, right? So we need to really identify who are our kind of who are we aligned with, the Therapy Alliance, to help support that all this great work they've done here, that they continue that and do more and deeper work, right? Or whatnot. And what's the next phase with that? So working with private practice clinicians and as well as universities is so important so like we can give that download and be able to create that kind of smooth handoff. And I think that obviously, someone such as Kellie and other providers that have this kind of specialty in working with emerging adults or young adults is such an important piece. But we need to be having these conversations of so that we can support such a seamless transition. So I'll let Kellie continue with that.
Thank you. Yeah, I completely agree, Jonathan. And it's all about that transition. It's all about the send off. And in private practice on our end, when clients are in counseling and we're talking with them about the next steps, another layer of support, maybe they aren't the right fit for private practice anymore. That is already scary to, be open to a totally different level of care, a different source of mental health care. So, pre-COVID, I was always encouraging my fellow clinicians and myself in my own practice touring facilities, not just calling and saying, are you accepting new clients, but really going there, being on campus. The clients that I've referred to Caron, when the parents say, well, what is it like? What are the rooms like? What's the food like? I can speak to that because I've been there. I've eaten the food, which is great, by the way. I've toured the facility. It's beautiful. What are the dorms like? What are the therapists like? Oh, they offer equine therapy. They offer this, they offer that. Oh, you know where it is? It's right off of this road and the area is beautiful. It isn't just, here's a list of referrals. I think that's good business, COVID or without COVID. And one of the things I love about Caron is that they're so open and so proactive in reaching out to practitioners. A few years back when I was new in my own practice, someone reached out to me from Caron, and her name was Julie, and I came and toured the campus and talked with her. And then when Adam reached out to me a few months ago, I already had that rapport with Caron. I already knew about their program. So a lot of us are trying to find more resources right now for our clients, but keep in mind that even if we can't tour campuses, in person right now, many places, including Caron, they're offering virtual tours as well. So.
And part of that Therapy Alliance is also working with our university partners. And what I mean, university collaborators. And it's a tough conversation, but the conversation is when you have a release signed. I mean, these university council centers are under so much pressure, and Dean of Students Office under so much pressure that there's so many laws, and we got to make sure that FERPA, the HIPAA, all these things are signed, but we need to communicate, right? Legally, ethically, we need to communicate in a way to support these seamless transitions. And it's a tough conversation, and in a lot of cases, I always share this in my presentations because I need to, is that, when I call a university, I say, I'm Jonathan Saltzberg from Caron Treatment Centers, and there's always, I feel like there's always like, why are you calling us? And the reason being is that, we need to educate these universities. We're not calling for referrals. We're not calling for, we have students with us that are transitioning to your college campus, and we need to work together to make sure they successfully transition on the college campus, right? Even if it's a virtual on the college campus, they still need that support right now. And I'm just amazed at what Kellie's doing and other providers are doing to kind of bridge that gap. And quite frankly, help our university partners understand that, we are, really trying to, aftercare and recovery for life. I mean, if you look at a collegiate recovery model, you look at a continuum of care, the greater the outcomes are based on how long someone stays in a recovery-oriented system of care. So Thank you.
Great. Well, thank you, Jonathan and Kelly. And so I would like to, with our last 10 minutes here, move on to the Q&A because there were some really good questions that came through. I do want to just jump in and answer another question about the semester of support. We will be continuing that post-COVID, and it may be a silver lining, and Kelly, you might, be able to speak to this as well, but that, now that we've all kind of adapted to going virtual, those tools are going to remain in place even when we are able to go in person. And I think that's going to add flexibility on all levels of care and resources. Students that historically, might have had to make some pretty sophisticated arrangements to come down to semester of support. Moving forward, I think, flipping the switch to being on virtual is going to be pretty simple for Jonathan and the team down there to coordinate. So that is going to be an ongoing program as well. And I imagine Kelly is with your practice that a virtual option for students that really need that level of flexibility, like you said, will be available also.
Absolutely. Absolutely. Yeah, we are offering telehealth right now. We're also offering phone calls. We will be welcoming clients back into the office sometime in January. We're not sure when that will be yet. We're, of course, going to follow all of the restrictions and guidelines surrounding that. But yeah.
Great. So I have our first question here is, I imagine many therapists like me are taking time off around the holidays. Do you have suggestions on how we can support college students while we are away from the office? Very timely.
I'll answer that if that's okay. So it is tough because, speaking to the self-care, we want to set boundaries. We want to have time off with our families during the holiday season. So, how can we support our students if we don't plan on offering those check-ins on holidays? So one of the things that I do, I feel like holidays are kind of the Super Bowl of our work as counselors. Like it's the big game. So we need to prepare in advance. I usually will go over, I'll come up with a game plan for my clients. And I know many of you are doing this, as we approach the holidays, talking about, well, what's coming up for you during this time of year? What always happens every Christmas? Well, what's the tradition at Hanukkah? Like, what does your family do? You know what I mean? What's that one dish? Like, I always self-disclose to clients and I tell them, if my mom and I aren't arguing about the string bean casserole, it's not Thanksgiving. Okay. So tell me what happens. What's the string bean casserole in your family? So just opening up that conversation, as we approach the holidays, recognizing that holidays are complicated for most people, including our clients. So talking about it in advance and then coming up with a game plan for the day of that you reference the month before the holiday, the week before the holiday, the session before, and maybe the session before is an extended session. Maybe it's an hour and a half, depending on the client. I usually will come up with, a goal sheet, some kind of document in advance for that specific holiday. And then you can tailor it so that, if you are checking in with the client on that holiday, you go through those goals. And if not, you see them beforehand, but they have the game plan for that day. They know what they're doing when they wake up. They know what they're doing, midday when their uncle comes over and they're talking about politics. Like, they have it all mapped out beforehand. And then if you aren't checking in with them, have them send you an email afterwards discussing how things went and then preparing that next session to be pretty close following that that specific holiday. I hope that answers it, kind of.
Yeah, that's a great point as far as scheduling out. If you can't do that, session during the holidays, at least having it on the calendar and, kind of a plan in place moving forward. It's wonderful. The next question I have is kind of a two-parter, but they overlap. The first part is, do you see the additional use of technology during COVID leading to problems with technology addiction or disorders? And then also a second part kind of layered onto that is, what suggestions do you have for students who are struggling with the virtual learning environment?
I'll go. My name is John. My name is Jonathan Salzberg. I will go. We at Caron Renaissance have a digital use disorder track. So we believe, and the research is showing, that how the brain reacts similar to a substance is very similar to someone who is developing that dependence on the digital use. So we've developed a track that we're very proud of that is able to address that. The piece with the virtual technology and the those who are having trouble with the virtual technology, I think is, again, very, very difficult right now. I mean, what we're looking at for our individuals who are struggling with, staying on top of the materials, we've asked for some of the professors to provide lecture notes in advance. So sometimes you're just getting the lecture notes here and how do you keep up? And, I found it to be very helpful for some of my students to get the lecture notes in advance, right? So that before the class comes in, a lot of you professors do that, but not all, right? But look at what the strategy is, right? All we need to look back is what strategy are we using as a student to really effectively get the most out of this educational experience. And part of that is advocating for ourselves. So asking for those lecture notes in advance. If you don't understand a concept, yes, you got to go to the professor's office hours. So some students I'm working with is, hey, did you go to that office hour? Oh, you don't need to. Maybe that's not part of the requirement for the class, but have you? Oh, you didn't. And you're saying you don't understand this material, but really holding them accountable to that and really rewarding them when they do it. Like, yes, like the positive validation, but just like we say sometimes, you got to make a big school. You can take a big school into a small school. You can't make a small school into a big school. What that means is using all the resources. You can take this virtual learning experience and make it the best you can, as close as you can to an actual in-person experience. And to do that, you have to really take advantage of all the resources, office hours, scheduling points to the professors. Now, if they're not doing appointments or there's challenges with that because of the pandemic, those are things that you need to be bringing up to your academic advisor. You need to be bringing up to me or to other people, right? But really, I mean, taking, the advanced lecture notes, having a structured time each day that you're studying. There's a rule of thumb that we all heard of: from one college credit hour, there's 3 college hours, 3 hours outside of that you should be studying it. That 1 to 3 rule. So, I mean, looking and allocating that time, specialized designated space. I know, like, for me, when I'm working from home, I need a designated space so I can just honor my time and not be checking on my son all the time. Hopefully collaborate with my wife to see whose time it is to oversee that. But really, designated space, designated time, creating structure in a fairly chaotic system always helps. So,
yeah. Kellie, there's actually a third part of that question that maybe you can chime in as well. But this was a question from a therapist asking, how can we make telehealth treatment engaging for college students specifically who are already on Zoom all day? And it probably applies to high school students as well.
That's a great question. And that's something that we have been reflecting on a lot at our practice. It's kind of an interesting time with online learning and all of the Zoom and virtual things going on. The students that really struggled with boundaries surrounding screen time are struggling even more now. But on the flip side of that, I kind of want to play devil's advocate for a minute here and suggest that all the screen time is also maybe drawing some of that energy, so taking away some of that luster of being on a screen or looking at their laptop or their phone all day. I've had some clients that, use screens pretty heavily in the past say, I'm sick of it. I just want to go for a walk, or I just want to get outside. So I think it's also a great opportunity for college students to reconnect with their relationship with nature, their relationship with themselves. So, I'm kind of seeing both ends of the spectrum. It's such a time of extremes. So we're kind of seeing both ends of the spectrum on there in terms of making telehealth sessions more engaging. So some of the things that we do in session when we're trying to build rapport, like, talking about, well, where is your safe space? What are you passionate about? Especially with young adults, really connecting with them on a personal level, a spiritual level, talking about things that they really are passionate about. So I think it's been a great opportunity. And I didn't think of this. I mean, I had some of my longtime clients sort of do this on their own, like organically in the telehealth session. They were like, well, here, this is my room that I was telling you about, and this is my cat. And that desk that I have that I told you I always journal in when I'm anxious. Well, this is that desk. So I think just taking the opportunity to use the space. I've had clients join me from their backyard or their garden, and they want to show me that. They want to show me how powerful that is. They want to show me their yoga mat where they're meditating every day. So, using this space and really familiarizing ourselves with, our clients' surroundings and what they love, what's personal to them. It just gives us a whole other layer of perspective on where they're coming from. So we're in the process of trying to be creative about that. I think just asking them, what they're passionate about or why their room is their safe space. Show me some of your most valuable items and what they mean to you. Things like that might be a good idea.
Thank you so much. And thank you, Kelly and Jonathan, again. We are coming up to the end of the presentation here. So I just want to, again, thank both of you for all of the wonderful information and for presenting today. And I'd also like to thank everyone who joined us. As a reminder, today's presentation is eligible for 1.5 continuing education credits. An evaluation will not come up directly after this webinar is over. You're going to receive it in an email, in a link sent to your email. So keep an eye on your email for an evaluation link, because you'll need to complete that to receive the 1.5 hours of continuing education credit. And upon finishing the evaluation, you will have immediate access to your certificate of completion. Next slide, please. We're going to talk a little bit about another webinar we're hosting. So Caron Treatment Centers will also be hosting another webinar this Wednesday, December 16th, entitled Empowering Women to Find Hope, Healing, and Strength in Recovery. We will follow the story of 3 different women from 3 different socioeconomic backgrounds, see how they've been impacted by the COVID-19 pandemic, and how their addiction has surfaced as a result. 2 of Caron's top female clinicians will look at these cases live and construct a treatment plan that will provide the best possible recovery outcomes for each of these women. Visit caron.org/webinars for more information on this next webinar and all future webinars as well. And also keep an eye on your email for details on how to register. And finally, please reach out to your local regional resource director at any time for additional information, resources in your area, or questions regarding admission to any of Caron's programs. I am available by cell phone or email anytime and would be happy to connect you with any of the members of the wonderful team here at Caron or any of the wonderful providers such as Kellie that we work with on an ongoing basis. So again, thank you all for joining us and have a wonderful afternoon.